Are you someone who's suffering from recurrent nasal polyps? Are you someone who's already underwent few surgeries in the past? I am Dr. Devkumar Rengaraja, ENT and skull-based surgeon from Fortis Hiranandani Hospital. We need to understand what a nasal polyp is. A nasal polyp, a grape-like thing that starts to occur in the nose and the sinus cavity. The most important thing in any disease is to find the root cause, to find why the person is having these nasal polyps. Now, there are multiple causes for this. It could be inflammatory in origin, it could be fungal in origin, it could be isolated sinusitis, it could be non-type 2 inflammatory polyps. Now, finding and categorizing these patients as per to that phenotype is very, very vital to cure them of this problem. If someone is not able to categorize them and treat them accordingly, then it's a recurrent problem. It keeps recurring, and never ever it gets cured. The ideal way is to find the reason. Now, how do we do it? Is we take a little imaging help, we take some few blood tests, and also we do a nasal endoscopy, and further we treat them medically. Now, despite good adequate medical treatment and a nasal douching, if the polyps don't regress in size, that's when we subject them for an endoscopic sinus surgery. Now, endoscopic sinus surgery needs to be done in a complete fashion so that the entire polyps in the nose are removed from all the sinus cavity. It's about creating a neo-sinus cavity which would be douchable. Now, what is douching the nose? Douching the nose is just like what our yogis used to do. It's as good as rinsing the nose. The rinsing the nose is the most key factor in preventing the recurrence of the nasal polyps. So the person has to wash their nose every single day post-surgery to prevent the recurrence of the polyp. Now, despite doing all these things, we need also to find what was the inflammatory trigger. And these days, there are certain biologics that are available in the market, which also helps to prevent the recurrence of the nasal polyps.